So welcome to the clinic.
Thank you.
Gabriella, lovely to have you here. Today we're talking about injectable treatments, particularly filler injection treatments. So maybe can we start off with a bit about yourself and what you had in mind?
Yeah, so my name is Gabriella. I am a hypnotherapist. The treatments I've had in the past have been rhinoplasticity and a bit of lip filler. I had a bit of Botox as well. But today I want to do my lips, and I was thinking about maybe having a bit of under eyes, filler in the under eyes, and whatever else you may suggest.
Perfect. So we had a good chat off camera. We just for everyone to understand, we've spoken about medical history. We've gone through the consent process. We've covered all the risks off. So I just want to kind of fast forward to the bit where we're doing a facial assessment so we can agree on a plan.
Yes.
The two main things you spoke to me about were the nose and the lips.
Yes.
And why would you say those are your priorities?
I think that I know that we're not all, what's the word?
Symmetrical.
Symmetrical, that's the word. But I think it's very noticeable in that one side of my nose is very kind of bumpy and got contours. The other is more straight. So I want to create balance. Also as well, my top lip is considerably small. Well, I feel is a lot thinner than my bottom lip. So I want to create balance as well. And more of a natural look. But yeah, just to create some symmetry.
Okay, got it. So what I'm going to do is I'll go through everything and I'll tell you what I see. And then if you're happy, we'll do that plan. Okay.
Sorry to interrupt this video. Hi, I'm Dr. Tristan Mehta, founder and CEO of Harley Academy, and I'm the one doing the injection that you're watching right now. I just want to take a moment to talk about our injectables diploma. So Harley Academy is a higher education college for aesthetic medicine based out of the centre of London, UK. And over 3,000 medical professionals have gone through our academic programs to achieve a postgraduate diploma in aesthetics. They will get a title after their name, PG Dip Aesthetics. If you want to learn more about our programs, how you can gain your qualification and learn how to inject in a really structured, systematic and evidence-based way, then click on the details below and our team will be happy to have a conversation with you. Right, that's enough from me. Let's get back to the video. But if you are enjoying this and you want to see more content like this, please subscribe and click like.
Let's talk about the face and what we see in thirds. So upper third is hairline to the glabella, middle third is glabella to the base of the nose, and then this is the lower third. So we've got equal vertical thirds. Anything that stands out, well, first of all, I think she's got very good radiant skin condition. I think she's got excellent symmetry in the upper third. I think the nose is where we start to lose a little bit of symmetry in the mid face. And then we have a very balanced lower face as well. And you can see this on profile in that all of these features have equal amounts projection, and also where it's appropriate, we have no projection. And so you can see the chin, then we have the crease, we have the lips, we have the nasolabial angle, we have the projected nose. We don't have a significant dorsal hump, and then we have a nice rounded youthful convexity to the upper face as well. So I'm actually reasonably happy with the face. I'm very happy with the face on lateral view. I think a lot of our opportunities are in subtle enhancements to various facial regions as we go through the face systematically. So upper face, brow, excellent. Temples, we have a general volume loss, and in your early 40s, you're going to start to see some volume loss to these characteristic areas, and temples is definitely one of them. So we can look at treating the temple. I also then see in the mid-face we have this beautiful cheekbone, but I can imagine that if we enhance this a little, it would be even more striking, and that's going to be quite important if we're going to also add volume to the temples and then the area beneath the temple as well, the lateral cheek fat. So there's definitely a sequence here that's the temples, the lateral mid-face and the medial mid-face, which together would look really, really nice. You notice around the eyes, we don't have any supraorbital hollowing. There's no indication to treat above the eye, but if you look upwards for me, chin down a little, you can see here that there's some shadows under the eye which would respond very, very well to tear trough treatment. So I think that's definitely a great indication. back to the midline now. And here we have some irregularity to the dorsum of the nose. I can feel this. Gabriella doesn't talk about much of in the way of history of any trauma to the nose, but I can certainly feel there's some irregularity to the bony surface of the nose. And so some filler to try and override that and create a narrow, very smooth dorsum to the nose would be very aesthetically important in this case. We can also consider just creating a little bit of elevation to the cartilaginous aspect of the nose, which will, I think, ever so slightly improve the aesthetic, particularly on profile. If you notice that the nose, the tip of the nose starts to point downwards, and we can instead get it to be pointing more forwards. So that's how I would assess the upper and the middle third. If we take a look at the lower third in isolation, one of the first things I notice is actually we have a relatively elongated upper lip. And in female patients, ideally we would have 1/3 upper lip, 2/3 lower lip, 1/3 upper lip and 2/3 this lower portion of the stomian to the menton. And so what I see is that if we can create some vertical height in the upper lip, we're going to narrow this gap. And in the process, we're actually going to feminize the lower third. I think the upper third is very feminine. I think that the middle third is very feminine with these beautiful cheekbones. And then the lower third has the possibility of becoming even more striking and beautiful if we manage these proportions. And so that means increasing the vertical height of the top lip. And at the same time, I noticed that if we create a little bit of projection at the apex of the chin, pointing in this inferior direction, if we turn all the way this way, we can see that if we create a little bit of projection like this, it would also be a really nice feature as we have continuity from the gonial angle all the way down to the anterior aspect of the chin. I don't think we need to do any treatments at the corner of the jaw or the mandibular border, which for me are all really in fantastic condition. So in summary, this is a full face treatment using filler in lots of different depths, lots of different areas. But how do we decide what to do first and how to sequence things? Well, first of all, following our principles, we're going to start from the top of the face and work our way down. We're going to start from the lateral cheek or the lateral face and work our way medial. And we're going to start deep and we're going to work our way superficial. And so following that algorithm, that gives us a sequence for how to treat the face. And it will start with the temples and it will finish with the lips. Does that sound good? Mm-hmm. All right, then let's get started.
Thank you.
So let's start off with the temples. How do we decide which type of technique to use for the temples? Well, each of them have a different effect. If I was really focused on lifting the tail of the brow, I'd be thinking about any treatment that goes underneath layer 3 of the temple, for example, the interfascial technique or the periosteal technique. If I had a broad, diffuse area of volume loss that I wanted to treat, I would be thinking about the subdermal technique. In this case, what I'm really interested in doing is treating a mid-sized area of diffuse volume loss and also supporting the tail of the brow and, of course, also creating some support in the mid-face. And so to do that, the ideal technique is the interfascial technique. And I'm going to demonstrate that on this patient. We start off by identifying the temporal crest and, in addition, the lateral orbital margin. And then I also identify the superior border of the zygomatic arch. This gives us the visible portion of the temporal fossa in the anterior to the hairline. And my approach is to actually enter the interfascial space from the forehead because the plane underneath the frontalis muscle is continuous with layer 4 in the temple. This is a good chance for us to recap what exactly is going on in the temples in terms of anatomy and vascular risk. So first of all, I'm going to palpate for the superficial temporal artery. Usually we just find it pulsating anterior to the tragus. I can feel that here. And then we can follow this along. I can palpate it here. And really, I'd be really interested to know whether we have the artery within our injection plane. And we don't. So the artery in this case is fortunately staying within the hairline. So I'm not concerned about the superficial temporal artery. The reason I picked that up is not because I'm actually in the same depth as that, but because it's always important to know where that artery is for any injection we do in this area, as it actually has anastomosis with the internal circulation, and that means that it does carry some of the significant risks that we are concerned about with filler treatments. But if we go through the layers, we've got the skin, we've got the subcutaneous fat, a small amount of subcutaneous fat. Then we have layer 3, which is the superficial temporal fascia. That's continuous from the frontalis up here to the SMAS of the midface and the orbicularis oculi muscle. And it's actually within that superficial temporal fascia that the superficial temporal artery lives. It lives between a sandwich of two fascial planes of layer 3, and that's where the artery lives. Underneath the superficial temporal fascia here is our interfascial space. And the reason it's called the interfascial space is because it exists between the superficial fascia and the deep temporal fascia. And this is a plane that's suitable for injection because it does not contain any arteries. So that's why it's considered one of the suitable injection depths for treating the temples. But importantly, it's deep to layer 3. And because it's deep to layer 3, it allows us to have some of these benefits of creating tension across the brow and across the midface. But also, importantly, it's a plane which does not have an artery. It does, however, have two important structures. One is the facial nerve, and number 2 is the sentinel vein. So there is a vein that lives in layer 4 as well, and that vein is draining from the supraorbital vein down into something called the middle temporal vein, which is much deeper in the temple. And so when we're injecting in this interfascial plane, we have to still be careful because we could lacerate that vein and it could cause a deep and painful hematoma, and we don't want to do that. So I'm still going to be injecting carefully, but I'm conscious that I'm deep to the superficial temporal artery in layer 4. So with that in mind, I'm going to be using a 22 gauge cannula, and I'm using a projecting filler, in this case, Revanesse Contour. And I stand on this side whilst I'm injecting because it's very comfortable for me to do that.
What we learnt in aesthetic medicine even 1 or 2 years ago is now outdated. Why? Because aesthetics is still a relatively new science, and the research underpinning our work, particularly our understanding of anatomy, has advanced significantly. Hello, I'm Dr. Tristan Mehta, founder and CEO of Harley Academy, and I want to introduce you to GEM, the Global Evidence Matrix. GEM is a dynamic, evidence-based framework that gives injectors a clear, consistent guide for safe, effective treatments, all grounded in science, not in corporate sales pitches. GEM combines clinical research, anatomical knowledge, and injector expertise, and it's always updated with the latest evidence. Think of GEM as your interactive map for facial aesthetics, guiding you through every step from technique to product choice. With GEM, you're not just injecting, you're working at the forefront of medical aesthetics. Join us in setting a new standard for safety and results.
So let's make our entry points. Now, normally I'm very clear that the cannula entry point doesn't need to go any deeper than the skin. But in this case, this is one of the few injections where I need to take the cannula all the way down to the frontal bone because I'm deliberately trying to go into this space that's deep to the muscle. From here, we pass through the skin, through the frontalis, and now over the temporal crest, and you will find yourself into this depth. This depth looks like it's under the skin, but it's underneath under the muscle in the frontalis and underneath the superficial temporal fascia in the temple. This plane, this interfascial plane, is normally closed, and so it can be quite tight. And so what I'm injecting here is with a gentle anterograde and retrograde movement, fanning into the interfascial space. And this is my slow controlled movement so as not to cause any laceration or trauma to any structures that I will find in this depth.
Am I right in thinking that that layer 4 in the forehead, that subgaleal plane, is the same as that interfascial plane in the temple? So once you get down through the frontalis muscle, you know you're in that glide plane straight into the interfascial plane.
Yeah, exactly right, Max. And if we therefore use the forehead as a way to drop into this depth, it's far more reliable. I have previously treated from beneath, but you're struggling to find that surface that allows you to know that you're in that same depth. So here we have half a syringe into layer 4 in the temple.
Instant, isn't it?
Any pain at all?
No.
All right, so now the thing we're going to be always interested to see after a temple treatment is whether or not we get some nice improvements to the tail of the brow, the corner of the eye, but also the mid-face and sometimes the corner of the mouth. So let's just, if I say look into that camera coming off the ceiling, sit forwards for us. Beautiful, okay. So I hope we can appreciate here that we have a good elevation to the brow, but also this eye. If you look at the lateral canthus of the eye, notice that it's a little bit higher up on this side. Maybe you can also see a little bit of lift to the jawline as well, as we've started to create this tension and projection in this direction. So this is the power of the temple treatment, is you can improve the face in all of these different dimensions. Same on the other side now. Just palpate for the superficial temporal artery. See if we do. Okay, I have a pulsation here this time. Okay, so I can feel this. This superficial temporal artery is right in the middle of my temporal fossa that I'm trying to treat. And it is then moving superiorly up the forehead, and I can feel it here. This is important because I'm not going to inject, I'm not going to make my entry point here, I'm going to be beneath it. So here, I can say that my entry point is beneath the superficial temporal artery as I make my bony contact, and we just give it a few seconds. Okay, great. And then we drop behind the frontalis muscle into layer 4. And now I can slowly advance beyond the temporal crest. There. So here, I've just got my finger here on the superficial temporal artery still, so I've just got my landmarks, and I've got anterograde pressure as I open up this space.
It's really normal to see, and I wonder whether it is a little bit of compression of the sentinel vein, some, particularly the venous structures are popping up a little bit.
Yes,
on the surface, but I'd say 9 times out of 10 that settles down within a couple of hours, and almost always by the next day.
Yes, absolutely right. That's somehow we're increasing the venous pressure, and we do see these surface veins pop out more after temple filler treatments. We can be very slow and gentle in this area. That's done. Now let's take a look at the entire temples. If you look back into the camera, head off the bed a bit. Perfect. Now, I'm already happy with that. Can you see that? See a little bit of refreshing going on?
Yes.
All right, good. Now rest your head back. Now we're going to start talking about the midface.